Okay, welcome Aliyah to the Dental Hygiene Basics podcast. So excited to have you on because you were my former student and it's
Mhm.
been really amazing to watch your journey on social media. You're sharing such amazing content and I know everyone loves it. I love it. I'm watching, I'm like, this is great stuff. And it was really funny because I had someone else post one of your videos and I was like, oh wait, that's my student. like I don't know why I really hadn't come across many of your videos before then. So love what you're doing. I would love for you to just share a little bit about your RDH origin story. How did you get to this point?
Thank you so much, I really appreciate it. Basically, I wanted to go to community college because I didn't really have family support when I was going to school, so I knew ultimately, I was gonna be responsible for paying for it, and that was all I could do at the time, and I had decided I wanted to be a vet tech. I loved helping animals, I loved everything to do with it, and I had been volunteering at one, so I was like, "Let me do that." I went to a school that had the vet tech program and I applied for a scholarship, and the president of the school ended up talking about this new dental hygiene program, about how amazing the career was, and just about all the opportunities that come along with being a hygienist. And basically, I started looking into it. I had always kind of considered a healthcare career, like helping actual humans instead of animals. And once he brought it up, I started shadowing my hygienist. I started doing all the research and started looking into it. And I really saw myself loving it. And I ended up doing all my prerequisite courses and kind of deciding between the 2, and that program that he was talking about never even actually ended up opening up until, 4 years later because of COVID. So I applied to UT Health San Antonio, ended up getting in, ended up having the wonderful Professor Pal as my instructor, and I'm so happy I made that decision.
Yeah, it's so funny. I don't know your background. Like you were
Yeah.
my student for so long. I feel like I know you so well, but I didn't know your background. I just see you when you're there. And me seeing you sitting in that class and in pre-clinic, I'm like, no, that was what you're supposed to do. Like I just always was like, yes, this is Aaliyah's calling for sure. So I'm so glad. It's kind of funny, like Kismet, how things like that happen. All of a sudden you were on this one path and then it just shifted.
Yeah. It was so random, and it's actually crazy to think about because the scholarship opportunity was pre-COVID and everything was in person, so you go and you sit in this entire room, and it's like a conference table, and there's 10 to 15 very serious, very, professional-looking people, and I saw them asking other people first. They're asking all these serious questions, they're not laughing, they're not smiling, and they're, judging your answers, basically, and you were allowed to bring a family member, and I remember looking to my grandma and thinking, "I wanna leave, I'm too scared, I'm so nervous." And now I think back, I was so close to leaving, and if I would have left that opportunity, I never even would have been introduced to dental hygiene, which is crazy. Maybe
Yeah.
at some other point, but that was my turning point, so that's really crazy to think about.
That really is. I know life puts you on the path that you're supposed to be on, and it's a wild ride sometimes. So, thinking about when you started your prereqs, when you started dental hygiene school, like what was that time gap like? Because you were kind of on a different path originally, right?
Yes, so I graduated high school and I started my prereqs right away, and that was 2018. It took me about 2 years to finish my prerequisite courses, and then UT Health specifically, they have that waiting period where you have to finish your last science course a certain amount of time before you can apply. So I had to wait, that period. Then I applied the first time to UT, and I for some reason just didn't understand how competitive dental hygiene was at that point. I had always had good grades. I hadn't ever really struggled academically, and so whenever I applied, I didn't realize, but Palo Alto had sent my old transcript. So they sent a semester behind, so it showed certain courses of mine were in progress instead of being completed. So whenever my application got sent in, it didn't show those final grades and it automatically, I guess, just got kind of filtered out or put out. And so I ended up getting technically rejected, but I never got the rejection letter or anything like that. I was just bugging the front. I was like, "Do you know if I got in? Do you have any updates on if I got in?" And eventually she said, "We've already sent out the acceptances, so if you didn't get one, you shouldn't get it," basically.
My gosh, what a heartbreaking thing, but it's
I cried and cried and cried. I was so upset, but now, like, meeting my class and meeting the people I ended up going to school with, and even you weren't even there at that time, so if I would've gotten in, I'm so glad it happened that way, but obviously in the moment, you don't know those things, so I remember, like, sitting on the couch, I was, like, bawling because I was really upset.
Yeah.
But now yeah.
I know, and I love to share those stories because I had the similar situation where I applied and I didn't have the waiting period. Like I knew I was going to finish my class, I knew I was going to do fine in it, but that time wasn't there. And so I got the rejection too. And I'm like, I paid an application fee for no reason because I
Mhm.
just didn't know how the game was played, right? How you were supposed to do this. So love that you're sharing that part of your story. And okay, so in that time, what did you do? While you were waiting to apply again?
So, after that rejection, when I was thinking in my head, "Okay, wow, this is, 1, really competitive, it's very serious, and I need to make sure all my ducks are in a row before I have to wait an entire other year." Because a lot of other healthcare professions, you wait 6 months, 3 months. Dental hygiene is one of the only ones where, like, if you don't get in, you're waiting an entire year. So I looked into everything, found out exactly how much it would cost to go to UT, and that was my personal goal. So that entire year, I was working 2 or 3 jobs, and I was just saving, saving, saving. And also, I spent a lot of time with my family, and I know you know about it, but my grandpa ended up passing away during dental hygiene school, and I lived in Hondo at the time, and I'm so close to him, and so I got to spend so much time with him and my grandma, and now looking back, how I was so upset, so, like, sad that I didn't get into the program that year, and I just think if I got in, I would have had no time, I would have been studying, I would have been in school, and I really wouldn't have been able to enjoy those last good moments with my family member who's not here anymore, and so I'm just more grateful than anything that that ever happened.
Yeah, and I love that you have that perspective on it because it's so true. Everything really does happen for a reason and that extra time is for a reason and you got the benefit of that. And I like that you mentioned it too because sometimes I ask, what did you do in that year and you're like, "Okay, I, became a dental assistant." Like I look back on my story, I'm like, "Okay, I did all these things so that the next time, I was going to be ready." But really, I wish I would have probably spent some more time with my family and friends and maybe given myself a break, right? And just enjoyed the phase of life that I was in. So I really like that you say that because yes, we do always want to be progressing forward. I love that you have the goal of, starting to save up money so that that would take off a huge amount of stress and burden once you got into school, but you
Mhm,
also focused on really the most important thing in life, which is your family. I love that.
mhm.
Yeah, and I know that, I've touched a little bit on about grief in dental hygiene school going through, with some other people that I've talked to on the show, but how did you handle that? Because that's really difficult to go through.
I had never been through anything like that. My grandpa was the first person I've ever lost, like, in my close family, and so to go through that on top of, like, going to hygiene school was so difficult, and I remember when it first happened, I stopped caring. I just feel like once someone you love passes away, you're like, "These things don't matter, like, grades don't matter, this test doesn't matter, my homework, I could care less." And so I went through that for a few weeks, and luckily I had some wiggle room to where I could, turn off school for a few weeks and it wasn't the end of the world, but I think what really saved me in my experience is that just by chance, by an unfortunate circumstance, my entire friend group had gone through the exact same thing. Every single one of my, like, 4 super close friends have lost someone super close to them, and 3 of them, it happened during hygiene school within a few months of me, and we were all there for each other, and we literally had multiple lunches where we would sit and eat, and we wouldn't even really talk, or one person would say one thing, and we'd all just start crying because we were all going through, like, the same stages of grief at the exact same time. But also we get each other's minds off of it and, try and distract each other, but I just think it's extremely crazy that we all met, and then we all went through a very similar situation, which is really sad, but we all helped each other through it in a way.
Yeah, absolutely. I know. And you have to have those connections and people to fall back on and, feel that support because it's so hard to get through it anyways. And then when you're going through something so heavy as that, it's just it can feel insurmountable. And one thing you mentioned is you had some wiggle room. I mean, I know that you were an incredible student. I was always like, Aaliyah's on it. Like she's got it. And that does help, right? Like, and you had such a good foundation from the beginning. I saw the efforts that you put into your schoolwork and, preparation and planning, and like you were very intentional about your work. And so that really does help because there will come a time in dental hygiene school where things get hard. If for you, your hard was dealing with that grief, right? For others, it may be being a parent. Like there's so many of these external things going on, but at some point it's going to get hard for some reason. And
Mhm.
having that solid foundation to start with really does make a big difference. But yeah, this is part of the reason why I wanted to have this conversation with you is because I remember one of your classmates, her grandparent had passed away and she had to leave for the funeral. And like the professors, we didn't know. Like, I remember, I think she told me, like, the next day or something, she's like, "Yeah, I had to go," or something like this, and, she's so upset, and I felt so guilty because I'm just thinking, like, I had no idea, and so I kind of wanted to have that conversation to tell students, it's okay to fill your professors in on what's going on in your life, right? Because they're gonna keep operating the same way day in, day out, but they will treat you with care and kindness knowing what you're going through, right?
I think it was the day after or maybe 2 days after we had clinic and, there is no wiggle room. You have to go see your patient, you have to go do what you're supposed to do, and so I had to show up, and I was dreading it more than anything. I wanted to be anywhere else other than, seeing a patient, and it just happened to also be an older man who was almost the exact same age as my grandpa, looked very similar to my grandpa, and it was such a hard, like, clinic day, and my friends, they all brought me flowers, they all brought me a card, they brought me, like, my favorite drink. They went above and beyond to, like, make me feel comfortable, and we all tried to do that for each other. And referencing the exact scenario you're talking about, I didn't feel comfortable the day of his passing to, like, say anything. I didn't feel like I could bring it up because I just felt like personal life and school life, it's different. And one of my professors actually noticed I was super upset, pulled me outside in the hallway and told me, "Go, leave. You need to go be with your family. Like, this is not where you belong right now." And excused me, but with the specific situation you brought up, that student actually ended up taking the 0 on the quiz. So I know it ranges, you know what I mean? So I think that's why it's important to have wiggle room because you never know. Some things are negotiable, some things you can, slide and work with, and some things they can't really move around. So I do
Yeah.
think it's really important to have some space to take time when you need it, you know?
Yes, and that's part of the reason why formal education was hard for me because I'm like, I want to live within the wiggle room. Like, I want to treat my students like humans, you know? I know we have to have boundaries and I can't always say yes to everything, but that's just the hardest part about being an educator because sometimes you're stuck between a rock and a hard place, like in what you can and cannot do. And that's really
Yeah, and
challenging.
I don't know if I insinuated, but it was not your class. She took a 0.
Oh, yeah.
Yeah,
No,
okay.
no, I was like, I don't think I've ever given anyone a 0.
Yeah,
Yeah, but I've had some other situations, like at different programs I've taught at where, I wanted to make some type of accommodation for a student. I was essentially told, like, you can't do for one what you can't do for everyone else. And I was thinking, this is like a case by case situation. It's just like your
yeah.
patient. You have to tailor the care to the patient. And so that can be really challenging when you're dealing with those types of things. But beyond that, I'm glad that you had such a good support system getting through it because that's really important. And that's one of the things I always ask: what's your favorite memory in dental hygiene school? And people usually say the friendships that they had. Do you feel like
Oh
that's your most favorite thing?
100%, and the friends I made in hygiene school, I'm still best friends with now. We all made a book club, and we meet once a month, and we just share, like, our journey of being new dental hygienists and all the challenges and solutions and tips, and a few of them temp, so they really have a good range of experiences to share, and we just kinda help guide each other while we're learning all this new information that's getting thrown at us.
Yes, I love it. Yeah. So, how has new grad transition been? Because it's been a year and a half,
A
2
year and
years.
a half, yeah.
Yeah.
It has been really great for me. I worked at one office. I've been at one office the entire year and a half. I haven't done temping or anything like that. And my office is just extremely supportive. So they let me just gradually start seeing patients. I think my first day I saw maybe 4 or 5 patients, and they really let me make things to where I'm comfortable. I really wanted to do things the right way that we learn in school. I wanted to, do everything somewhat by the book, and they really made a lot of changes and adjustments to where I felt comfortable. And you know how it is when you transition from school into, like, the real office, a lot of times that people will say, you don't do that in the real world, or oh, this isn't school. But they did really good about hearing me out and making changes where, they agreed that changes needed to be made. And I feel really comfortable there. I get really good times per patient. My doctor gives me pretty good autonomy to where he trusts me to, help him co-diagnose perio and all those kinds of things, and teaches me things I wouldn't have known just from school. A lot of it's on the job training. So I'm really happy with my office. I think that can make or break a new grad experience, honestly.
Yeah, it really does. I've
Yeah.
kind of had like a good and a not so good experience, but it's hard, but I think, for me, I was the same. I was like, I had this standard of care that I wanted to meet,
Mm,
but also I've learned now that I was always meant to be an entrepreneur.
yeah.
I just like to do things my own way, and that was always kind of challenging for me. I want like full autonomy, or really good autonomy, and that can be hard to find. So I'm so glad that you have that, and that you feel supported. That's really important. And I also want to ask, to share that there's light at the end of the tunnel for all of these students who are
Oh,
in
mhm.
school right now, right? So, okay, I want to flashback just a little bit because did you have any dental experience going into it besides your shadowing hours?
I had no dental experience besides the shadowing hours. I mean, other than being a dental patient, I went in for my checkups and stuff, but I was not an assistant. I didn't complete any assisting courses or anything like that. So my first experience was asking my hygienist, "Hey, can I watch what you do? Tell me about how you like your job." I don't regret that because I hear it's really hard to go from dental assisting to dental hygiene just because the schedules are exactly the same.
Yes, and it can be challenging too because you have to unlearn some things that you've
Mhm.
learned, or I find that a lot of assistants get frustrated. They're like, I know how to do this, or I know what this is, and you kind of like resist against it. Or you might think, I've been an assistant for, however many years, and we never wore this amount of PPE to do this. Like you think too much of the real world. It can be really hard to kind of think about the importance of why you're being trained the way that you're being
Yeah.
trained. With that being said, dental hygienists are very strict. We like standards and like the CODA accreditation, like how schools are accredited and what you have to teach and learn and all those things. I mean, it's strict for a reason. It's because hygienists created those rules. So I'm like,
Yeah.
there's something to be said about, I think, the level of care that we are taught and that we provide. I really do think we go above and beyond. And some people may think that's unnecessary. I think it's what makes us amazing. I don't know. What do you think?
Completely agree, and I think it's so important to keep the same standards, and I think it's so easy to just fall into the routine of, "Well, my doctor, told me to do it this way, so I'm just gonna completely, agree and do whatever they say," because we do learn a lot in hygiene school, and a lot of times it can completely conflict with what we're told outside of hygiene school. So I think we have to bring our knowledge and our education into it, and we have to know at the end of the day what's right and wrong, and just make sure we hold up the same standard for the patients ultimately. But I do agree. I think it's very strict for a reason because patients at the end of the day count on us to do all these things. And if you don't hold up the standard, then they're the ones who pay the price at the end of the day.
Yeah, and I'm someone who's dealt with a lot of health issues, and I've been to a ton of different doctors, and I think about how I've been treated and like things swept under the rug, or someone's like, ah, you're fine, it's just this, or it's just anxiety, or whatever. And I really think about how I wanted to treat my patients in my chair, which was like, I've got you for an hour, which is most health professionals do not get that amount of time with you. And so for me, I was like, I want to use the highest scope of my knowledge, my education. I want to do everything by the book because I may find something that another provider misses because I have the time to do it, right? I mean, that's like a big
It
deal.
and honestly, I think a lot of my patients this was a new grad experience. Whenever I went out into my office, a lot of my patients weren't, I feel, used to that because I could tell some of them were kind of like, "What's taking so long?" Like, "Why is my appointment taking the full hour?" Just by their faces, I could tell they're shocked when they look at the time and we took the whole hour. They're shocked when I'm asking them about their routines. They're shocked when I put the blood pressure, cuff on them. They're shocked, all these things, they're the pre-rinse. So many people don't like pre-rinse, it's hilarious. And even one time, I had someone make a comment about me talking to a patient about their diet, and I heard someone say, "Why is she talking to them about their diet? This is a dental office." And to me, that just shows, like, the disconnect that there is from even dental workers and even patients. People don't understand how, everything's correlated, and the food you put in your mouth is completely related to if you get cavities, if you're high risk or not, your GI tract, everything's related and people don't know. So that's my personal goal, is to like share as much education as I can in a way that's easy to understand for patients.
Yeah, and that's an amazing goal. And the thing is, you don't know what your patients are also going through. Sometimes, you said there's that disconnect in the dental office. They may not understand the relationship between nutrition and caries, right? And overall health. And at the same time, the patient doesn't either. So the patient showing up and they've got ulcers in their mouth and they're like, what are the ulcers? And you start asking questions like, well, do you have upset stomach, frequent
Mhm.
diarrhea, vomiting, things like this? And they're like, yeah, I do. I'm like, well, you might have, some type of issue going on with your GI tract. It could be celiac, it could be IBS, something's going on. Like, if it looks that way in the mouth, what does it look like inside of your intestines,
Yeah, 100.
And I just think that when we really take that seriously, again, we could change lives. We can catch things that other people can't because one, we have the knowledge to do so, we're trained to do so, and then we also have the time to do so. So I'm so happy you're enjoying your new profession. That just makes me happy, and that you're trying to uphold the standard because you're right. It is hard once we graduate. Okay, I want to ask because you were just such a good student. I was always like, man, like Aliyah is always on it. How did you manage dental hygiene school? Like, what were some of your key things that helped you to be organized, but also to learn that complex material?
So, honestly, I feel one thing that helped me a lot was when I was taking my prereqs, you look at, rate my professor. And there was this one professor who had a terrible rating. And all of the ratings were, this professor's so hard, this professor doesn't like give leniency ever, that whatever. She had a terrible rating. I took her class, the best professor I've ever had, the most structured, and this was for A and P, 1 and 2, nutrition, all these extremely difficult classes. She gave us a guide on how to study, and I took that into hygiene school and studied the exact same way, and it was so helpful because all those hard classes we take in prereqs are, like, training you on how to study whenever you're in hygiene school, and all the classes are pretty much difficult. And so, basically, she would print out these questions, and she'd have us either type out or handwrite the answers, and what I do is I would literally either highlight them and repeat them to myself. I'd write them on the whiteboard. I'd write them on my iPad. I'd write them in my notebook. I would write these answers or verbally say them to a study partner until I knew them, by heart. Like, if I couldn't answer it or if I couldn't write it, I didn't know it. So, my thing that helps me or works for me is just repetition. And especially, focusing on the stuff that's more important. Obviously, not every single detail, but that's the study tool I took into hygiene school. Me and my study group, we'd go into the library and we'd write things on the whiteboard for like 3 hours, 4 hours per study session, and we'd test each other. And if we couldn't answer it to each other's face, we'd be like, go back and study, and then come back and we'll test again. So we were pretty hard on each other. And I mean, all of us ended up being super successful in the hygiene program. So I feel like you just need people to hold you accountable and who, have similar goals and similar study techniques as you.
Yeah. And what you mentioned sounds like you were doing a lot of active recall and then the repetition, which is how your brain likes to learn, right? It's kind of like a computer downloading information. And the more you see it and the more you review it, but you have to be able, like you said, to almost speak it, teach it. Like if you can't explain it, you really don't know the material. And
Yeah.
I think that's something that students just don't really do. I've noticed that a lot with my tutoring. I'm like, okay, tell me why you chose that answer. And they cannot tell me why. I'm like, okay, just say anything. Don't worry about sounding stupid. Just start talking and we'll see where the gaps in the knowledge are. So it's really helpful if you have someone who you can bounce that off of, like you had with your study partner. So I
Yes,
love that.
for sure. I always say, like, reading before the class, that's exposure 1.
Yeah.
Then you go in class, you've already seen it, the professor explains it really well. usually, and then you can take notes if you want. That's exposure 2, study it, that's exposure 3. And actually, a lot of the students in my class, there was like a little group, and they'd always come to me in my study group and they'd be like, "Teach us everything you know," before the exams and stuff. And so we'd be explaining things to them. And like you said, when you can teach it, you're good.
Yes, yeah, I know, and that's the thing. We have to think about how do we maximize our study time? Because, and I'll be dead honest. Okay, I would maybe read before class. I I would kind of pay attention in class. I did interact with the instructors, like I would ask questions, but I also would get really distracted. Like I'd be on Facebook, or Facebook was like the thing, there was no Instagram
Yeah.
or anything when I was in school. At least not that I remember. Actually, I think Instagram came out when I was like maybe in my senior year, which is like really wild to think of. Yeah, because there's a picture of me drinking a beer when I passed my board exam. So I'm like, okay, Instagram was brand new. But with that, I spent the bulk of my time teaching myself. Now, I know that that is how I learn. Like, I like to be alone and quiet and really dive into the material. But I also think I could have saved myself a lot of hassle if I really did read before, like you said, exposure
Yeah.
number one, pay better attention in class, which I tried to do. I don't think I was like as bad as I make myself seem, but still,
Mhm.
I would easily get distracted. And then,
Well,
like you said, the studying.
yeah, and I think it really depends on knowing yourself and knowing the classes because there's definitely classes where I didn't. And if I naturally was just kind of picking up the information, like for me, dental anatomy, I didn't really ever read. I just kind of paid attention in class and that was all I needed. But then classes like radiography or classes like, oh my gosh, pharmacology was reading the chapters twice before going into class because I was like, what the heck is going on? I think it just depends how much effort depending on how difficult the class is for you.
That is true, and sometimes my level of engagement directly tied with how interested I was in the material.
Yeah.
Like, I loved oral path and pharm and all that, so I'm like, "I'm here."
Yeah.
I totally get it. No, I love that, and you're right. I mean, your class was rocking it. Y'all were very, I think, doing a great job, and I like to use you guys as an example because I'm like, "This is how you do hygiene school right." You have the camaraderie, you have the friendships, you have the study support, like, you're rolling through it in this way. But what about the sheer amount of information? Because, it's like, it's easy to tell someone, do this, 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 and this. And they're like, okay, but I have to do that for 5 classes and I have clinics. So how do you juggle all of that?
I completely agree. It's so much at once. What me and my group did that worked well was we started to try and do the studying shortly after the classes because I feel like the worst thing you can do is procrastinate and save all of the studying to do at the end of the week when you've learned all this new material for all 5 classes. So, what we tried to do was meet briefly. At the end of the day, we'd go to the library, sit for an hour or two, and just study in smaller increments so it didn't all pile up and become overwhelming. And we also tried to share a lot of the work. So we loved Quizlet. And so we would take turns creating Quizlets on certain topics so it didn't all fall onto one person. And we had a small group, so it wasn't like a big group of 10 people doing that or anything, because I do think ultimately you still learn while you're making Quizlets. So I like to make a lot of them myself, but we'd share occasionally so that the coursework was more manageable and we'd all still study and be effective in learning the important information too.
Yeah, that's such a great tip. I love that you said you focus on that material like the day you learned it. That was the goal because that
Yeah.
really is the idea behind spaced repetition. Like you're exposed to it, like you said, like you read it, then you hear it in class, then you look at it again the same day, and then you can start spacing it out, right? And also having time to kind of download that information, right? Giving yourself good sleep, some quiet time, relaxation time here and there to download the information is needed.
Yeah, because if you wait too long, we learned pretty quick that you forget the way the professors explained it. You forget what they said was important, what was not important. And also, you don't want to be, emailing your professor, what did you mean on this one PowerPoint 2 weeks ago when you said this? Like, it's not relevant anymore. So it's best just to do it, as
Yeah,
close
as it
as
goes.
you can.
Yeah, yeah, I love that. Such a great tip. Let's see. Well, what would be your number one piece of advice for a student? Maybe like a, future version, kind of like where you were, you finally decide you want to go to dental hygiene school. What advice would you give that person?
So for me, I feel like I might have overdone, the studying. I felt really prepared. I went into hygiene school thinking I want to learn as much information as I can. I paid for this information. I want to be the best hygienist I can be. And I kinda went into it like a sponge, you know, I just wanted to absorb everything, and I feel like a lot of times I put so much energy and effort into hygiene school, and I didn't always have enough energy when I went to see my family, when I went to go do other events that weren't about school, and it made me feel burnt out toward the end of the semesters. I was done, I was exhausted, I was like, "I need to reset, recharge," and I feel like I personally could have done better at balancing it. So I do think it's important to do your best in hygiene school, to learn as much information as you can, but to definitely have a balance and to know, okay, let me try and get a lot of this work done during the week. So on the weekends, I can spend a day with my family. I can spend a day doing something I love because a lot of people get burnt out in school. And that's the last thing you want to do when you have to go through that for 2 years is get burnt out on the first semester.
Yeah, that is so true. Yeah, and thinking through, that balance, it's so hard because you kind of
Yeah.
have that fear in you at all times, right? Like,
I was like, "They could kick me out every single week." I was like, "You know, you fail one thing and you really are scared that you're gonna have to start all over." And, I forgot that that's a whole mindset in hygiene school.
it really is. And, it can be hard to drop that too. Do you feel like did it take time for you to like kind of leave that version of you behind, or do you feel like it's still there inside of you?
I felt a little, like, traumatized, honestly, after hygiene school, like, wanted so bad to go and do fun things, to see my family, to go on dates with my boyfriend. I wanted to do all these things whenever I was in hygiene school, and then I left and I was like, "I need to study. Where's my laptop? Like, I need to check my email." Like, it took me weeks probably to get in a good mindset of, "I don't need to check my laptop every 5 seconds. I don't need to check if I forgot a homework assignment." I was, like, still in school mode for honestly weeks after I left.
Of that. Well, thinking through, because you mentioned that, you had that year, you were saving up money. So did you have to take out any loans or did you mainly do scholarships? How did you pay for school beyond what you saved up?
Yeah, so I had tried to save everything. I had tried to save where I didn't have to work at all during school, but the expenses, it's always just a little more than what you plan for, and so I ended up taking out, the what is it called? The government loans? What are those called?
Like a federal loan?
Yeah, federal
Yeah.
student loans, and I took out the max that they'd give me because it wasn't that much, and I was like, "Okay, well, this will at least give me wiggle room, the interest doesn't start till after I graduate, so best case scenario, I don't spend it, and I have all this money still in my bank, I'm just gonna use it to pay it off." So I did that the 2 years, I did that both years we were in school, and I had a little extra whenever we finished, so I just did that lump sum payment, and then I just made big payments after I started working because I was like, "I do not want that hanging over my head."
Yeah. So what was the total amount whenever you graduated or roughly?
I believe it was about
Okay.
$13,000.
Yeah, that's not bad at all. Yeah. And then how
Yeah.
long did it take you to pay it off?
It took me about, I wanna say 5 months?
Okay.
4 or
Yeah.
5 months? Yeah.
That's quick. That's amazing. I
I
mean,
also
kudos.
worked during hygiene school to try and pay for my actual expenses, so I wasn't relying on the loans because they were supposed to be my backup and not really the money I was actually using, it was just emergency money, and so I worked as the student life worker for the school, and I made pretty good money, the best money I've ever made, honestly, and then I worked as a server as well, so those were kind of my jobs to pay for my food, my gas, my, bills here and there, and it worked out pretty good to where, like you said, 13's not bad for hygiene school, I feel.
No, and that's like an amount that you can commit to paying off quickly.
Manageable.
A very manageable amount. Yes, exactly. Because, like many people have way more than that. So,
Yeah.
yeah. And that's why I encourage people because I'm like, now all of your money is yours, right? You bought a house. Congratulations. I mean, that's and how old are you? I mean, you don't have to share if you don't want, but
I'm 25.
25, graduate, no debt, owns a home or no school debt. I
I
don't know about
know.
your house.
No school debt, just home debt now.
Just the mortgage, yeah, and,
Yeah.
as you're paying into that, you're building equity in your house, which is amazing, so I really love that part of your story because now students can hear, like, what it's like on the other side and what could be possible financially. Okay, thinking about now, one of the downsides to hygiene, and this is not every office, there's different scenarios, but often they say there's no retirement, there's no benefits, right? right? There's some downsides to a career in dental hygiene. What has your experience been like with that? And do you feel like it's possible to still be successful financially as a dental hygienist despite not having those things?
Yes, and I do think it's definitely something to consider if you're maybe the main one in your family who would provide those things. But I think we're getting better as a profession to where there are opportunities out there. Even in my small town I live in, there's two corporate offices where they do offer health insurance and they do offer benefits. So if I felt like that was a big priority for me, I have 2 options, and like I said, it's a small town. If I drove to the city, there'd be way more. So I think those things are becoming more accessible, but also I think that the amount I get paid is enough to where I feel comfortable setting aside amounts, and I don't necessarily need the retirement, I don't necessarily need the health insurance, stuff like that. Personally, I do get sick time at my office, I do get PTO days, and so I feel like that helps a lot being able to take the time, just helps with burnout and stuff like that. But I don't think it's a reason to not want to do dental hygiene because the options are there if you need it, and I've met with a financial advisor to where they kinda give you tips and ideas on where to put your money to where you'd get the same outcome, when you're done and retired, you'd have that money to live on either way. So I don't think the negatives necessarily outweigh all the positives that the job comes with.
I agree 100%. Honestly, I think dental hygienists are uniquely suited to become millionaires. I really do think that because we're disciplined, we're structured. Once you have the financial knowledge in place, and sometimes that's a whole nother leg of learning that you have to do, or, you get help from an advisor, but you start planning that. And like you said, if you don't have that debt hanging over your head, the income in dental hygiene can be very, very great, right? Especially in clinical. You take that money, you're using it wisely, and you're consistently saving, whether that's in a or high yield savings or, a saving up for a house, whatever that is. I don't know. I think it's possible to be very successful financially as a dental hygienist. And I don't even work clinically. And the one day I do, I hardly get paid anything because it's public health. So, I just say that because I really want people to think about that when they graduate, starting to think about those
Oh,
things.
yeah, for sure. Fortunate to where my partner is able to provide, health insurance, and so that's just something that's not super high up on my plate, but I know for some people, that is super important, so I just like to tell people, like, the opportunities are there, and maybe that's just something they should look into really well. Dental jobs are around you. What opportunities do you have? Because I know there are smaller towns than the one I live in where there's probably one dental office and you get what you get sort of thing. So that's a good thing to look into and to be aware of before you commit to school and, the whole process.
Absolutely. Yeah. And you have to think about what are your priorities and what are your needs as well, like you mentioned. I've gone through both. I'm married and there were times where my husband had the health insurance and there were times where I had it, right? And then
Yeah.
sometimes he had a retirement plan and sometimes I had it. And then sometimes we had neither and we had to pay for health insurance out of pocket. So there's always a solution to that problem. But thank you so much, Aliyah, for sharing your story. I would love for you to share where students can find you and see all of your amazing content that you're putting out on socials because it's such a valuable resource. So go ahead and share where they can find you.
So I'm on TikTok and I'm on Instagram. My handles are a little bit different on each social media site. So I don't know if you can maybe like type them out so
Yes.
that you can see okay exactly what they are. But I love to post like educational content, relatable content, and just build a positive dental hygiene community where we feel like we can go and talk and about all the stressful things we go through in school and as dental hygienists when you're done. I'd love to connect with people on those 2 apps.
Yes. Thank you so much. Well, have a great rest of your night. And I
So much,
appreciate you.
Professor Pal. I'm always gonna call you Professor Pal.
I love it.
Right,
That's
you
okay.
got it.
It's still my favorite nickname.